Okay, we will move to the last session of the morning, Climate Smart Transport Solutions. In this session, knowing that transport plays a crucial role in the healthcare sector, we will explore how virtual wards and sustainable logistics can reduce emissions, improve patient well-being, and contribute to a greener future for communities. I would like to introduce our speakers, Kate Townsend and Paul Flattery. Kate works as a program manager in the Southeast region for the Greener NH team and has worked in sustainability for the last 2 years. Within the NHS, she leads on a few priority areas, including digital sustainability and supply chain. Paul is the senior pharmacist for virtual wards at Hampshire Hospitals NHS Foundation Trust. He holds a postgraduate diploma in pharmacy practice and qualified as an independent prescriber. Welcome, Kate and Paul. The floor is yours.
Thank you very much. That's a really lovely, very kind introduction. I'm very gracious to be here as well. I'm very gracious to be held. I've already had my introduction. So I'm Paul. I am the pharmacist in our virtual ward at Hampshire Hospital. I'll let Kate start.
Yeah, hi everyone. I'm Kate. Me and Paul are going to do a double act today. So we're going to talk to you for the next 15 minutes or so about a collaboration between NHS England and Hampshire Hospitals to really look at the carbon footprint of technology-enabled care. So just to give some context, really, the NHS was the first National Health Service to make a pledge to go net zero, and we were the first to put it into legislation within the Health and Care Act 2022. So the NHS contributes about 5% of the UK's carbon emissions, which might not seem like a high percentage, but is roughly the same carbon footprint as the country of Croatia. So although we are at the forefront of the impacts of climate change, we're also a significant contributing factor. On the screen here, you can see the carbon footprint of the NHS. We've got a pretty good understanding of where our hotspots are, but we're starting to look at the carbon footprint through the lens of the patient pathway. It allows us to get that level of granular detail that really educates us on where we can increase efficiencies and reduce emissions. So really getting that truly sustainable healthcare system. So amid environmental concerns and during the pandemic in particular, virtual wards has emerged as a really promising alternative to care. And promising alternative to a traditional inpatient stay, which we know has quite a high carbon factor associated. But we've never really done the research to prove this. And I think it's really important to look at this so that we don't inadvertently increase our carbon emissions. Yeah.
So for those of you that don't know, what is a virtual ward? A virtual ward is defined by NHS England as a safe and efficient alternative to care to an NHS bedded care. Virtual wards provide support to patients who would otherwise be in hospital to receive the acute care and treatment that they need in their own home. In our medium-sized district general, we support a population of about 550,000 patients. And this population is expected to grow by about 5.4% over the next 20 years. So what we do in our healthcare system locally, and I'm sure you all have the same challenges in your regions as well, how do we cope with this expanding population and how do we cope with these challenges? So at present, our virtual ward offers support to 50 patients on our virtual ward beds. And these are predominantly frail older people or those being supported for acute respiratory infections. NHS England has set the task or the expectation that virtual wards will grow and expand to support 50 patients per 100,000 of your population. You can clearly see that we have some way to go. Virtual wards are provided by blends, and this is where we fit in, that blend of remote care and face-to-face in that patient's own home. There are clearly overlapping elements to that. You can't do both individually. We, in our service, do the predominant amount as the remote care, and we utilize the services in the community for the face-to-face elements where it's appropriate for those visits. So our recent service evaluation looked at our service over a 63-week period to June 22, and reviewed 1,392 patients that had been on our ward then, of whom 844 had been deemed to avoid a hospital admission. So that saved a length of stay per patient of 3.7 inpatient hospital bed days. That accounts for a financial saving of £1.6 million. So we believe that virtual wards are a beneficial way to prevent avoidable hospital admissions and support earlier discharge from hospital.
So our project started with setting 3 sort of quite clear objectives that you can see on the screen. So we really wanted to understand the carbon footprint of a virtual ward. We wanted to identify the hotspots, the areas of high carbon, and think about ways that we can reduce them. And we really wanted to look at the environmental benefits of an inpatient ward compared to the virtual ward. So we're going to reference CO2e, which I'm sure you all know is kilograms. We're talking kilograms of carbon dioxide equivalent. So very luckily for us, we had a national toolkit that was produced by the National Greener NHS team that did a step-by-step process of how to calculate the carbon footprint of a virtual ward. So it had pre-assigned carbon factors for things like inpatient bed days, and it just allowed for that sort of really detailed step-by-step process that we could get a consistent way of measuring the carbon footprint whilst capturing the sort of nuances that Hampshire Hospital's pathway had.
So over the period of time from May 22 to May 23, we pulled all of the patients that had been on our virtual wards over that time period. And that's the 1,392, sorry, in my last point, it was 1,113, but different data time periods. So of those patients that had been on our virtual ward, 10% were excluded for data quality issues. We parked those, they weren't involved in the analysis. And that left us with 1,260 patients, of which we were able to split in the 532 that were on our acute respiratory ward and the 728 up there on our frailty virtual ward. We were then able to drill down that data to look specifically at their hospital pathways and hospital journey and their virtual ward journey and assign the appropriate carbon factors to each of those points. We conducted a detailed case review of a smaller quantity of our patients and literally a day by day, hour by hour process of reviewing those patients' cases, that really deep, detailed analysis that you wouldn't be able to conduct on a larger scale otherwise. So that gave us those clinical quality assurances that what we were doing in our larger group was accurate from our smaller group. So that's quite difficult to understand from a large scale bit. So it's kind of much easier to see that from an individual patient's journey. So this is one of our more costly patients who enters our virtual ward. The patient starts their journey, as every patient does in their hospital journey, at home. They contact the emergency services, who this time decide to take that patient to hospital. We know from the NHS Greener Toolkit and the work that's gone on before us that each ambulance conveyance accounts for 56 kilos of carbon per journey, which is huge. That patient is then taken to the hospital emergency department, where they are reviewed, assessed, undergo the appropriate diagnostics and treatment. That process costs that patient 14 kilos of carbon. That patient then goes into our hospital and is admitted. They have a length of stay of 15 days. And again, diagnostics, management, acute treatment and care whilst they're in there, and their transport home from hospital accounts for 580 kilos of carbon, an average of 38.7 kilos per day. They then have a length of stay of 11 days on our virtual ward. And we've accounted for the transport of clinicians out to see that patient, the assessment of tests when they are on that virtual ward, where those tests go and how they're managed within the wider system of our pathology lab, the protective equipment that our clinicians wear when they've gone out to see that patient, and all those interactions from there. Interestingly, within there, that 7.4 kilos per day of that cost is purely from that patient's home heating. So of that 141 kilos for their 11 days, 12.8 kilos is the average daily consumption, of which a large proportion of that is just from their own home heating. Now, not every patient of ours has a journey like that. And as we've already talked about, our virtual wards are able to reduce ambulance conveyances, avoid hospital admissions, and support earlier discharge. And as a result of that, a significant number of our patients don't have many of these carbon touch points at all. And so we're significantly able to reduce that average per patient and that total consumption per patient, which Kate will show more and explain more on the next one.
Thanks. And Paul's being very humble there. It wasn't us that did the deep dive of patients, it was all Paul. Okay, so the findings. What we're trying to show here is we know from the toolkit that the high dependency ward is really high carbon factor at 89.5, as you would expect. Then, as mentioned, we know the inpatient stay is 37.9. What we start to see in the next two rows is what happens to a patient when they are admitted on a virtual ward. This is an average admissions per patient per day. So when a patient is admitted into a virtual ward, or through their admission through to discharge, so including all the carbon points that Paul just pointed out, their average carbon emissions per day goes down to 24.1 per patient per day. And then we narrowed our analysis even further, looking at the virtual wards element only, and it came out as 8 kilograms of carbon per patient per day, which is really low. It's a really, really good finding and really confirms that virtual wards is the low carbon model that we'd expected. We did another analysis that looked at prevented carbon emissions. So this is important to look at when thinking about increased capacity, and really adds another layer of comparison between virtual wards and inpatient. So again, we were quite lucky. We already had previously created methodology to calculate the bed days saved for virtual wards, which for our cohort came out as 6,064 bed days saved. So we use that number to then calculate the carbon emissions or prevented carbon emissions. And that came out as a whopping 283,000 kilograms of carbon that was prevented. And that was over sort of 13 months. So this is a huge, huge number, but it should, we've got to sort of make it very clear that this isn't a carbon saving. It's not a carbon reduction, because those beds were actually in use by other patients. So we're really capturing the increased capacity here. But also in recognition that 283,337 kilograms of carbon dioxide equivalent is quite hard to sort of figure out in your mind, we converted it to miles driven, which came out as 726,000 miles driven, which is just shy of driving to the moon and back. So much easier to picture, I guess. But yeah, again, fantastic finding for Hampshire Hospitals, really sort of reconfirming the power of research and analysis for this, and really confirming that virtual wards is a low cost and low carbon model of care. So despite those impressive findings, we did still identify hotspots, and sort of have outlined the top 3 that we found. So this is from the patient journey. This isn't from the just the virtual wards element, because we know that's really low carbon. So looking at the ambulance travel, I think it was 53% of frailty patients arrived by ambulance. We looked at frailty patients because they're a little bit more complex and more likely to require an ambulance travel. So we know that it's really high carbon. We know the vehicles weigh a lot. We know that they use diesel. And the total carbon emissions from ambulance travel for that cohort was 21,000 kilograms of carbon. So we're making some recommendations to look at alternative models of transport, and working with the ambulance providers to do that. We've got a net zero travel and transport strategy that's just been published, and we're working on rolling out electric ambulances by 2040. The second hotspot that we wanted to highlight was the emergency department attendants. So 45% of our total cohort went via emergency department, and we know these are really resource intensive environments. And in total, that equates to about 8,000 kilograms of carbon dioxide. in total. So what we're recommending is to look at referral routes, start training and educating staff on how to directly refer to a virtual ward when clinically safe to do so, and looking at the referral pathways. Oh, there's also the Royal College of Emergency Medicine has published a green ED checklist, so we can start working with teams from within the emergency departments to reduce the emissions there.
And so the final point was, obviously, when our patients are seen at their own home and clinicians go out to review them, and if we've taken any diagnostic samples, for those of you that work in clinical practice, you can take a set of blood from a patient, but that blood's not going to tell you the answer until it gets back to the hospital lab. And this highlighted for us our part in that pathology system, that there's 270 miles driven per day just between our sister hospital sites, because the laboratory's on one site, where those blood samples are run. We then add into that from our journey time and our transport within the wider GP, the community pathology network as well. That accounts for nearly 20,000 kilos of CO2 per year. So following on from this work, we've been able to venture towards alternative methods of transport. So we're going electric very shortly. But our virtual ward teams are very shortly also going to be able to use point of care testing as well, which will have a different flip on the CO2 emissions, but we will no longer fit within that pathology supply transport problem. So we're able to change and reduce our consumption from there. So in conclusion, I think what we've shown, and very reassuringly, is that our virtual wards, the work that we've done, shows our virtual wards to be a low carbon model of care. We've proven the analysis of the work that we've done, and actually produced a system that is able to be reproduced on scale. And we think that this should therefore be reproduced on scale within all of the virtual ward systems. It's benefited us to be able to see what we do and how we can do it differently in our system. And it's essentially validated the NHS Greener Toolkit that Kate and the NHS England team before her have implemented and created.
Yeah. I forgot to mention we were the first people to use this toolkit, so it's really good findings. In terms of next steps, we're looking at further research because we know there's variation within virtual wards, and Hampshire Hospitals really represents a low technology, low tech, low intensity virtual ward. There's others there that have much more transportation, much more face-to-face interaction. So we really need to do more research in that area. We're going to start obviously implementing the recommendations. It's all good writing this research, but we do need to drive action, and we really want to start implementing recommendations locally, thinking about short-term, long-term goals. And then we also want to spread learning across virtual wards networks. So we're looking to write this up into a peer-reviewed journal, and we're going to be spreading it across our virtual ward networks. And very much, if anyone's interested in utilising this toolkit with us, please do get in touch. And that's everything. Thank you very much.
Thank you so much for the great presentation. We will take a couple of questions before ending the session. So are there any questions for Kate and Paul? The one there.
Hi, just a question. Apart from the carbon analysis and the cost analysis, did you analyze what happened to the patients after they were released from the ward versus the similar patients in the real wards?
So not as part of this piece of work that we've presented, but yes, as part of our evaluation that I talked about, the 844 patients that we managed to keep out of hospital and avoided hospital over that 63-week review period. So we've done separate hits of analysis, and our virtual ward care, as well as saving that inpatient time, has a much lower rate of mortality, morbidity of our patients than they would have if they were otherwise managed either in that hospital environment or had not been supported from a discharge element out of our hospital. So we're both safe and efficient. It's good value for money. And this really adds an extra layer to that as well, that we now can say we're carbon efficient as well, or we're better carbon consumption than that patient would have had if they were in hospital. So it's adding extra pillars to why this is a really good model of care for our patients, which is really exciting to be a part of.
think there was a question here. Yeah.
Thank you. My name is Eva Maxon. I work for Klimact, which is an environmental consultancy organization here in Belgium. My question is, how common are these virtual wards in other countries? And also, would this be, do you think, a valuable suggestion for hospitals to transition to in order to reduce their footprint? Thank you.
The first part, the presence of them in other countries, I can only speak for what I know of in England. And as I say, there is an expectation that every hospital, every region within the UK at least is offering 50 patient beds per 100,000. And what a bed looks like for someone who is technically at home, 50 patients being managed for on a virtual ward per 100,000 of that population. So we're managing 50 patients on our virtual ward for a population of 550. You know, multiply that up by 5, there's a huge amount of growth potential that we have to achieve in our region. We're one of the, I'm much more humble, but in terms of higher achievers, we're managing a greater number of beds than some of the other hospitals or some of the other care organizations in our region. There is virtual ward work going on in the rest of Europe and further abroad. And some of that has a much larger use of technology and digital equipment and digital enableization for those patient management. I think what we're doing at the moment is capturing that low-hanging fruit, but there is more fruit to be gathered higher up. And I think with that comes greater carbon usage, but also actually greater savings compared to what if that patient was in hospital. And that's where I think we need to look at this from a wider context as well. This needs further, like this is the first bit of research, more needs to come and follow on with this.
So yeah, I think it's really important to think about the fact that our population is increasing massively and it's not likely to decrease for a number of years. Our hospitals are packed. Very rarely do we have an empty bed. We've got to start thinking differently about the way we treat people in a traditional way. It's been, yeah, we just need to revolutionize it a bit. And I think virtual wards is helping to do that.
Thank you.
I'm afraid it will be the last question because we are running out of time. So, but again, we will continue discussing about this topic in the breakout rooms, and Paul and Kate will be here.
Just a quick question then. My name is Tanis Helfer from Bern University of Applied Sciences in Switzerland, Nursing Research Department. Have you also, I like the quantitative aspects, which are obviously very important for carbon footprint. Did you also do qualitative analysis, example, patient stories for the ones that were cared for at home? So mixed methods and...
So we haven't done that for this analysis, but definitely we'd like to look into that element for the write-up.
Yeah, so patient stories fits in with, again, we've kind of captured carbon in this project. We've captured patient care and safety in a separate project, and we are doing work to capture patient stories and patient journeys within there. They all sort of fit within different parts of a puzzle that is all getting added together in a different way. We've had a rapid insights event essentially with patient stories. Patients like this level of care. Our patient feedback is generally really, really positive. They much prefer to be cared for at home in their own environment. No patient I ever speak to on a day-to-day basis ever says, please send me into hospital. I'd rather be there. It's a much nicer place to be. Yeah, absolutely.
Thank you so much. We have come to an end of this session, and now we will break for lunch. I have to give you some instructions before